Is this you saying who we are advocating to, or who is advocating?
We need eye health included in the county health plan, because traditionally it has been like parallel system. So we want eye health within the health system.
Our structure is as strong as the leadership that it has. So I think that for me the issue of the leadership becomes important in terms of what do we as a department want to do. And I think that situation analysis should come actually from also, so that we come and chip in terms of given the site SEPA's mandate, I'll deal with this component and somebody else.
Let the government take the lead so that they have a clear planned document of what they want done in IL. Then the governors, the supporters can come around the table, then they pick their areas with the government giving direction. This is our priority 1, this is priority 2, this is 3.
There's a way we can come together as we are doing now to find out that in those priorities of the government, how we can key in eye health. And we can do that. I'm not going to be making suggestions here, but that is the open thing that we can start thinking about. And that is the trend to which global advocacy is tending to. I'll end with asking this question. If you have a moment with the Minister of Health and he's in the 5th floor of what hospital now, Nikon, and you just walk into an elevator with him, you have like less than 10 seconds, I guess, to get to the ground floor. How will you market eye health?
I think we need to get hold of Department of Standards, Department of Policy, and then there's also the Department now of National Referral Services.
The opticians, whether they're qualified or whether they worked with you and decide to go and open an optical shop and sell glasses, that is the first person a person with an eye problem goes to. So we have to find a way of bringing them on board. And even now when we are doing a curriculum and when we are training, that they're also on board. So we are happy that everybody is receiving quality eye care services at whatever level.
The major problem in eye health in terms of optometry development in Nigeria in the 80s and in the 90s, even in the early 2000s, was the issue of dispensing optician and dispensary. I don't know what word it's called here, quackery. Okay, not properly trained persons, giving classes and all that. It was a huge issue, especially where I come from. The Igbo man opens a shop and start giving classes, things like that. So, but what we did, the truth is that sometimes you can't control it because they are the money bags. They have the money, and they, whether you like it or not, they have lobby. They know how to lobby policies in their favor. So one thing we just did was to bring them on board, on them, okay, offer them certificates. And you know what certificate does to the mindset of somebody, okay? So we had an optometrist and dispensing board of Nigeria. In this board was mandated with setting up accreditation guidelines for schools to be run, and then all existing opticians ran a program for them. Those that are existing 1-year training program, and gave them a period of 3 years to all take that program. Then fresh ones, they opened up a school of dispensing of optics, giving them diplomas. This way, their activities were channeled to be skilled, and then they were meant to get licensed and pay. Of course, it's money aiming for the government. And they were all happy.
Remember, the eye health is just a subsector, the bigger health sector. And the eye health will just depend from the kitty from the bigger health sector. So if we have a small pie in the bigger health sector, then the eye health services should only expect a smaller portion of that. Having said that, the government expenditure on the health services in this country has been oscillating between something like 4 to 7%, with an average of about 5.4%, way below the economic recovery strategy, which was put at 12%, and the Buddha Declaration, which puts it at 15%. So our government commits almost just below 50% or around 50% of that.
The moment we do that comprehensive situation analysis of eye health situation and have evidence that is documented, the national government will own it. And with the partnership with the NGOs, they can now go to the ministry and say, we are calling for a meeting, we are supporting eye health. Then the government says, yeah, we have a document. This is what we plan to do as a country in the next 5 years. This is the strategic plan. We have this and this and this. This is what, pick from here, you support. They take the lead. But what we have seen, Fred Hollows come and say our focus is cataract surgery. The government runs with cataract surgery. Sight savers will come, we are running with, they run with them.
What we should be thinking in advocacy is trying to find out the priorities of government and find out how we can key in. If we can key in the long run, we will be eating from the same table and we'll find out that eye health care will get the support it desires.
I believe we now need to involve at least them at the top level. There must be at least each of these persons, the four departments, representative for purposes of policy, guideline and capacity building. Then the ophthalmic service unit will be now our link with all these people. Then some of those opportunities we had talked about, like our presence in the counties. We need to talk to the county health management teams. In terms of awareness, we need to involve training institutions, because if you look at the flagship projects, the Vision 2030, we need to work on human resources capacity of the country. One of them, the flagship projects under the Ministry of Health this year, that can we have need-based training. KMTC should wake up and go to the counties, go to the learning institutions and tell them more about some of these courses, like optometry, where they always come to us as a last resort. Let's go to the various partners who are bringing in the funding. So we need to involve these people, but at various levels.